Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
From the timing of the lockdown to concerns about antibody tests, the government's scientific advisory group, SAGE, has published a series of documents showing some of the scientific and ethical advice it has been giving ministers since the crisis began. This comes a day after the committee's membership was made public for the first time, with the government under pressure to be far more transparent about its decision-making process. But Number 10 says it will not be releasing all its evidence. Our political editor Gary Gibbon has this report.
I shook hands with everybody, you'll be pleased to know, and I continue to shake hands.
Boris Johnson mocking the idea of giving up handshaking 9 weeks ago. The very day a government committee of scientists concluded the government should advise against greetings such as shaking hands. It emerged in a bundle of documents the government published today showing some of the scientific advice it's received on COVID-19. Boris Johnson didn't change his habits for some days after that advice was given. The Number 10 spokesman said he wouldn't have seen that particular document published today and changed his habits when official government advice changed. Amongst the bundle of documents on scientific advice released by the government today, one on easing restrictions. It has quite a lot of redacted material. The government said it was to avoid confusing messaging to the public. The same document also warns the government that if it were to lift the shutdown and then subsequently reimpose it, it would be likely to be seen as a serious failure of policy, and trust in public health advice will be lost. That is informing the government's movement towards another renewal of the lockdown on Thursday, followed by a cautious plan for easing things when it says the science allows. In a document the Scottish Government published today, it shows the advice it's getting from its scientists on what would be the potential impact if it were to reopen primary schools and nurseries now. The line on this graph shows hospital capacity. The better case scenario, the scientists say, could show little impact. The worst case scenario could be devastating, with tens of thousands of additional patients going into hospitals. The scientific advice, as so often, is not categorical.
From the very beginning of this crisis, I followed the advice of our world-leading scientists.
Today, one of those top scientists told MPs it wasn't quite so straightforward.
Trying to think if there's ever where we've given a single option. I doubt we've ever gone and given a single option. We're more likely to have said, here are the range of things with the potential effect sizes, and these are the choices you could make at this point.
Sir Patrick Vallance said he regretted testing hadn't been increased earlier. He was asked if he was pessimistic that a second wave of COVID-19 would hit the country.
If we do test, track and tracing well, and we keep the social distancing measures at the right level, we should be able to avoid a second wave. And so I'm on the more optimistic side that you can, provided you do it. And then I want to add one caveat, which is winter is going to be extremely difficult when you also have flu circulating.
How to avoid that second wave now dominates the government's work on the second phase of living with COVID-19. Don't expect it to be like the old days, the Foreign Secretary said today. Prepare for a new normal.
Gary Gibbon reporting. Well, a little earlier I spoke to the chairman of the Health and Social Care Select Committee, Jeremy Hunt, and I began by asking him why he thinks the UK seems to have a higher death rate than other countries.
It seems to me too early to say that, you know, we've got one of the highest death rates in Europe. We seem to be in a cluster with France, Spain and Italy. But what I think you can say is that the outliers, the countries which have much lower death rates, are Germany, South Korea, Taiwan, those kinds of places. And so the real question is, are we putting in place the strategies that those countries have? And
in your view, are we now doing what South Korea and Germany did? Is that our strategy just rebadged?
I think so. We're not there yet. We've still got to get this app launched. We've got to get the population using it.
But have you got to the bottom of why we have waited until now to be testing this app, rather than doing what South Korea and others did right at the beginning, which was to do the tracing at the same time as getting the testing up and running? They've been doing it for months.
In fairness, back in January, no one had a crystal ball that could say the country in the world that is going to be most effective at tackling coronavirus is South Korea. That's probably unfair to charge the government with that. What we can ask is, are you learning from global best practice? And I think the pattern that's emerging is that Europe and the US have been less effective than many countries in Asia. I think our starting point has to be prepared to consider what they've done in those countries. And, you know, Singapore, which is also a fairly authoritarian country, all the data that is collected is deleted after 28 days. So there are safeguards that you can put in place.
It was clear from Patrick Vallance's evidence to you today that the scientists do not regard themselves as leading the decisions. You know, despite everything the government has repeatedly said about, you know, we followed the scientists say, no, we just advise, we don't lead. You know, have we been misled, really, by the political messaging here?
The government is absolutely clear that they are being guided by the science, following the science is the phrase. But then when they publish their decisions, we can't see what the scientific advice was that SAGE has been given. So one of the things I asked Matt Hancock today is whether he could publish the SAGE advice that he's given at the same time as he announces the decisions that he makes. And I think the reason for that is that very often the scientific advice is not cut and dried.
And, I mean, would you do that if you were still a cabinet minister, though, rather than a select committee chairman? I mean, because that precisely enables everybody to second-guess everything you're doing.
Well, that's the risk, isn't it? But I just think in a situation like this, what you need to do, you've got to carry the public with you. And I think they understand that there are uncertainties with a novel virus. The genius of British science is that we allow challenge. So I think in this situation, there is a whole army of scientists working in our universities who would have views about some of the recommendations being made by SAGE.
What about the timing, though? I mean, the government refuses to acknowledge at any point that it did anything too late. And, you know, you can bet your bottom dollar that every report into this in the future will say we did everything too late.
One of the things that appears to have happened is that SAGE didn't model the potential of a test, track and trace way of doing things as they do in South Korea, because they said we just don't have the testing capacity. In practice, we were able to get that testing capacity in just 4 weeks, which was a pretty extraordinary achievement of Matt Hancock's, but we were able to do that. And so maybe with the benefit of hindsight, it's easy to say this, but I think if that had been modelled back in January, that would have given the government an option to follow that Korean model earlier.
What we've discovered today is that despite Matt Hancock's promise that anybody in a care home, even if they're asymptomatic, and the staff will be able to get tests, in fact, they can't, because Public Health England refuses to do them and says they've got to go and book them online like everybody else and try and get home testing kits, which, if you're in a care home, is pretty difficult.
Well, I imagine they'll want to sort that out very quickly, because Sir Patrick Vallance was saying today that one of his biggest concerns is the virus being reintroduced to the country through care homes. He talked about having different reproductive rates in hospitals, in care homes, and in the community. So I'm sure that's something they'll want to sort out very quickly, as indeed they will with the issues of PPE in care homes, which I know you've also been highlighting.
Jeremy Hunt.
As the number of COVID infections were peaking a month ago, a letter was sent. It was written by a senior public health figure, and it went to the chief executive of NHS England. When this crisis is over, wrote Jim McManus, and the inevitable inquiry is held, I and my peers will want to be able to say we've worked together effectively, not that because of a lack of collaboration, things were left which could or should have been done. He wanted to formally record his concern at the lack of transparency on information, social care beds, hospital capacity and ICU, that he believed would help local areas manage the epidemic and future impact. Inconsistency in sharing this would, he warned, create a serious risk to patient safety and lives. Now, we've all heard the calls from some journalists and opposition for greater transparency in the science which informs government strategy. But this suggests that for weeks there have been concerns coming right from the very heart of the medical community itself. That letter was leaked to Newsnight, and we'll be asking what questions it raises in a moment. But first, coincidentally, this was also the very first day an alternative group of scientists met to discuss their response to COVID, one they promised would be free of fear or favour from government intervention. Well, Nick Waters here. Just talk us through then this. They're calling it a sort of alternative SAGE group. Who are they?
That's right. So the 13-strong independent SAGE was set up after criticism of the real SAGE. That's the Scientific Advisory Group on Emergencies, meant to be independent and advises government. And the criticism is that it's secretive. The Guardian recently reported that Dominic Cummings, who's the Prime Minister's chief advisor, attended meetings. And then Bloomberg reported that Dominic Cummings had actually intervened at a crucial meeting in March to ask and advise for a hastening of the lockdown. Number 10 said that Dominic Cummings had not influenced that meeting. So today we had the meeting of this independent SAGE under the chairmanship of Professor Sir David King. He's the government's former chief scientific advisor. He took the lead in tackling foot and mouth back in 2001, and their big demand was they want greater transparency from the government. And one really sort of simple and fundamental question they posed to the government: what is your strategy? Do you want to suppress this virus, or do you just want to manage this virus?
And what has the government response been to this or to them?
Well, officially, Number 10 is saying that they welcome all scientific advice, but it doesn't take far to find out what they really think, which is they regarded as deeply unhelpful. But there was some government response today. So today's government chief scientific advisor, Sir Patrick Vallance, he today released a member of the participants in SAGE, 50 names, a further 2 names who asked to be anonymous. But of those 50, 27 in some form are on the public payroll. But Professor Sir David King was in the open today, so I took a chance at their press conference to say to him, are you raising concerns about transparency because you think there's a particular problem with this government, or is there a problem with any government dealing with an epidemic or a pandemic? And the reason why I asked him that was that he was in charge, he was the lead figure in responding to foot and mouth, and the lessons learned report into that talked about had an extremely difficult job because there was no clear account of decision making. David King told me, not the time now to be talking about foot and mouth.
Nick, thanks very much indeed. So now we know who's on SAGE, the Government Scientific Advisory Committee. They released those names earlier today, as you heard. But a key concern of both local decision makers and the scientific community is that the government's not releasing data, modelling, key information to help in the battle against the virus. Our health editor, Deborah Cohen, has this report.
Transparency is a fundamental aspect of science, allowing others to challenge and build on evidence and interpretation. Those are the words of England's Chief Medical Officer and Scientific Advisor just over a week ago. While we now know who is on SAGE, we still don't know what their scientific advice was to government. Yet evidence underpinning key government decisions is not all in the public domain. While we now know who is on SAGE, we still don't know what their scientific advice was to government.
It is not acceptable to not provide evidence of decision-making from public bodies that affect a huge swathe of society. There are decisions that will be made in this outbreak that are questionable. There will be decisions that are wrong, but you have to live and die by them. But the most important aspect is you need to put them out there so we can understand why they were made, and if they were wrong, we can think about changing them.
Not everyone agrees. Professor Robert Dingwall is a member of one of the groups that feeds into SAGE. It's called NerveTag, and it does publish its discussions.
We also have a strong tradition in the UK that the advice of civil servants to ministers is kept confidential so that there can be a full and frank exchange between advisors and politicians. And I think some of the same considerations might apply to SAGE itself.
The issue of transparency goes much further than the makeup and the advice of these increasingly high-profile scientific groups. Newsnight has learned that some local authority directors of public health are unhappy with what they perceive to be NHS England's failure to provide data about the extent of the outbreak in their local areas. We've seen a letter written a month ago as the number of infections were peaking from Jim McManus, Vice President of the Association of Directors of Public Health, to Simon Stevens, Chief Executive of NHS England. In it, he says, I'm writing to you at the request of the Directors of Public Health to formally record our serious concern at the lack of communication of modelling data from national and regional level from NHS England to help local areas manage the current epidemic and the planned future impact of this epidemic. He adds, in our view, the inconsistency in sharing of data now creates a serious risk to patient safety and lives, to which I am now requested to draw your attention. In the letter, he says local officials need the full details of the models to know likely demand for social care beds, hospital capacity and ICU beds. He also stresses the importance of estimates for excess deaths so councils can ensure people are properly buried or cremated.
The committee is now in session.
Concerns about transparency have reached Parliament too. The chairman of the Science and Technology Committee has asked Public Health England to make the evidence about why they rejected the South Korean approach to testing public.
Scientists and officials and government ministers are not going to get everything right. They're working in a fog of uncertainty. And so in making decisions, it's important to review whether they've turned out in the way that was intended. And if they haven't, to take corrective action for the future. And that's true of scientists, it's true of officials, and it's true of ministers.
The peak may now have passed, but the need for transparency has not, according to one public health director, who says clear data remain vital.
The things that are going to make a real difference are being able to do everything we can to manage the epidemic in our local areas. And that means both having that real-time surveillance data, whether that's coming from the testing systems or it's coming from other sources like NHS 111 or primary care, who are seeing maybe where hotspots are emerging.
While COVID-19 is posing unprecedented challenges, we did have another pandemic 10 years ago, the outbreak in the UK of H1N1 swine flu. Deirdre Hine led the review into the UK's handling of that pandemic. She looked at the issue of transparency, but fears not all lessons have been learnt.
I think there is a tendency on the part of government to want to control everything rather than accepting that there is intelligence locally that might make it easier for them to contribute.
England's Chief Medical Officer and Scientific Advisor say they intend to publish sage scientific advice. With discussions about how to handle the next phase of the pandemic underway, there's still a chance to learn from the past.
Deb Cohen there. In a statement, NHS England tonight told us, as Professor Keith Willett pointed out to Ms McManus over a month ago, his letter regrettably contained multiple misunderstandings and misstatements which were corrected at the time. Fortunately, in the intervening month across the country, the situation has moved forward and directors of public health continue to have a crucial role, including supporting infection control in their local care homes. NHS England also told us that its Chief Operating Officer, Amanda Pritchard, had written to regional colleagues asking them to share data. We asked the government to join us on the programme, but nobody was available. Well, joining us now is Professor Anthony Costello of University College London's Institute for Global Health, and he helped set up the independent SAGE group you were just hearing about, and also the senior backbencher Conservative MP, Sir Charles Walker, who sits on the 1922 committee. And since we've heard a lot of the background in Deb's report, can I come to you, Charles, first? There does seem to be clear evidence behind the scenes in that letter of concerns that this failure to share data could risk lives and patient safety. What does that say to you about this need for transparency?
I'm sure there are plenty of concerns. Governments had to make a number of very difficult decisions, and in this fast-moving environment, mistakes would have been made and concerns would have been raised. I'd be horrified if Jim McManus, on behalf of his members, hadn't raised his concerns. And I'm sure there are many other letters out there where concerns have been raised. I mean, we're dealing with the largest crisis since the Second World War. It's impossible to imagine that everything will go smoothly because there is no playbook.
But when you hear about the actual concrete impact this is having, this lack of sharing, local officials who are needing to know what the demand for social care beds, for hospital capacity and ICU beds. This isn't a sort of post-mortem analysis. This is stuff that could actually change and potentially save lives at the time. Why wasn't that kind of data being shared by the government strategy?
But that letter was sent a month ago, and I hope it elicited a positive response and a change of direction. I mean, of course we should place lots of expectation on government, but some of it is impossible expectation. The idea that it can get everything right all the time and meet everyone's requirements, I mean, that would be wonderful if it could, but no government can.
And I guess, Anthony Costello, you don't think that there was malice in that. You know that the government was trying to do the very best it could in the circumstances in which we all found ourselves. They were trying to do the right thing, weren't they?
Yes, I think so. I mean, look, I've always argued that there should be a no-blame audit of where things have gone wrong, as often in medicine. I mean, the Financial Times reported today, actually, that they believe that 50,000 people have now died from this surge in the epidemic. But the meeting we had today was driven very much by Sir David King's passion for transparency and also the need to be constructive. We were talking today about the future and trying to come up with ideas that could help the government. We weren't trying to be, you know, overly critical or destructive. And we were certainly talking about the slight confusion, I think, with people that is this government trying to suppress the epidemic or simply to manage the infection so as not to overload the NHS. And we pointed out that the WHO principles for lockdown or lifting the lockdown are rather different from the UK, that they put a lot more emphasis on local public health, on testing availability, having very clear quarantine plans and facilities. And they say that in finding every case, you want to refocus governments on real suppression. And the benefit of that is that then you will get your economy moving again because you'll be focusing on the people that really need to be down.
Can I just ask, because Sir David King suggested today that it was the chance for scientists to speak their minds without fear or favour, without a sense of political interference. Do you believe that SAGE, actual SAGE, is suffering from political interference? Is that what this is about?
Well, it's simply that if you are a government civil servant, by definition, you're not an independent scientist. I worked at WHO and I was on a committee before I joined them when I was an independent scientist and gave my opinion. When I joined them, I was treated as a non-independent person because you're paid by that organisation, you have loyalties to it. And obviously, if you've got your bosses or very senior politicians colour some aspects of what you say. Although there are many very good people in that committee who I'm sure have given very good advice.
Let me just bring Charles in. We're having a couple of problems with the line, but let me just get Charles Walker to respond to that. When the government tells us that they are led by the science, and when you hear key scientists saying, of course you're conscious if your boss is in the room, that is going to impact on what you say out loud, isn't it?
This is a national crisis. In this room of 50 or so experts, we're not talking shrinking violets here. We're talking about people who are at the top of their game, the top of their profession. This crisis is going to cost the country £400 billion, and that might be a good result. So the idea that you're not going to have some politicians in there who, after all, are elected to make decisions on the basis of the advice they hear and perhaps the competing advice they hear is just fanciful. I mean, I do understand that Alternative SAGE is trying to do the right thing, but actually to impugn, in a sense, the credibility and professionalism of those on SAGE, I think doesn't do them a good service.
Anthony's shaking his head. I'll bring you in 1 second. Let me just get you to unpack that, Charles, then. Do you think that the government is led by the science and what the scientists are saying, or do you think they are taking the decisions as politicians that they were elected to take?
I mean, of course, we elect politicians to take decisions. They sit and listen to the science. There may well be in that room, and they're going to publish the evidence and the data, competing views, competing concerns. I hope there's debate, but ultimately a government has to make a decision, and the government will be held to account in the months and years to come for the quality of the decisions it made. Right. There will be no hiding place on this. There will be many inquiries.
Anthony Costello, doesn't it make the alternative body then look like a rather self-indulgent sideshow? Unless you're actually saying you think these scientists are being used as human shields or are going to be hidden behind in government inquiries, what are you saying?
No, I think that, listen, science is about debate, and there are lots of bodies, the Royal Society and others, who are inputting to this. We came up with some fascinating things today. I mean, we had the world-leading mathematical modeler Carl Friston talking about how you can look at the impacts of policies rather than just the R-value, and showing in the United States, for example, where federal policies on COVID have been less successful from his models than local state policies.
But do you think anything would have changed if this alternative SAGE, with its transparency, had been going from the beginning? Do you think concrete decisions would have been different, whether it's on care homes, on the date of lockdown, on the containment strategy? Would actual concrete different decisions have been taken?
Well, I hope the date of lockdown would have been brought forward, because I think that's one of the reasons we've had such a difficult period with the explosion of the epidemic and the numbers of deaths. But the other really important thing is local ownership and control that came up again and again, that GPs and local public health staff, who are the backbone of our service, are being, in a sense, it seems, abandoned, the tried and trusted, track and trace methods for these centralized high-tech solutions, which are not really proven. And I think we have to be careful in trying to get control of, reaching for the magic app rather than doing the old-fashioned foot slogging of good public health. And a lot of other things came up today as well about how we can do better planning for effective clinical care, for new port control policies, what we would do in the absence of a vaccine, and also looking at some of the institutional amplifiers of the epidemic, prisons, but particularly hospitals, care homes and schools, where it seems that's where the major transmission is now going on. And we need to have redesigned policies that will enable us to move not just in the short term, but in the long term whilst we live with this vicious virus.
Thank you both very much indeed. Thanks for joining us this evening.